Today we're going to be talking about the basic anatomy of the shoulder. We're going to break this down into three areas: the bony anatomy, the ligaments, and then the tendons. And so starting with the bony anatomy, we have the main bones of the shoulder, which are the humerus, the scapula, which is the shoulder blade, and then the clavicle, which is the collarbone. So the humerus, at the end of the humerus is the ball or the head of the humerus, and this is covered with nice, smooth, articular cartilage that helps it glide with the glenoid, which is the cup side of the scapula. So we have the scapula, and then at the end here we have the glenoid, which is a socket-shaped structure that also has articular cartilage on it to allow for nice, smooth, frictionless motion of the shoulder joint. So the main shoulder joint is the glenohumeral joint, which is the glenoid and the humerus. Now the shoulder is also made up of a couple other important joints. So we have the scapulothoracic joint, which is the shoulder blade articulating on the rib cage. And you actually get about a third of your shoulder motion through this joint. You get about 2/3 through the glenohumeral or the shoulder joint, and you get about a third of the motion through your scapulothoracic joint. And it's very important for these two to coordinate and work together for that shoulder to function properly. So then the other joint of the shoulder is the AC joint, which is the acromion, which is the edge of the shoulder blade. You can feel it on the outside of your shoulder. So that's the acromion. And then the clavicle, so the acromioclavicular joint. And the last bony structure is this kind of pointy structure coming off of the scapula, and that is the coracoid or the coracoid process. Sometimes you can feel it if you push real hard in the front of your shoulder, you can feel that pointy bone there. And that's important because it has attachment sites for your pectoralis muscle and also for one of the tendons of your biceps. It's important to note that the other tendon of the biceps actually runs over the humerus and through the shoulder, and it attaches to the labrum at the top of the glenoid. This can be a common irritator of the shoulder and can lead to increased stress on that labrum, leading to labral tears. So that's the bony structure of the shoulder. So then talking about the ligaments of the shoulder, so remember, ligaments attach bones to bones. So the main ligaments of the shoulder joint, remember that's the glenohumeral joint, are the glenohumeral ligaments, and those attach the glenoid to the humerus. So really they form a pouch around the glenoid, kind of like this pouch you see here, and that's what we call the capsule. The capsule is kind of like a balloon that just envelops and surrounds the whole joint to keep the joint in its own environment. Keeps the fluid within the joint and allows for a nice, smooth, gliding surface for that articular cartilage. In addition to those ligaments, surrounding the glenoid is the labrum. It's not really well depicted here, but it basically, the labrum goes around the periphery of the glenoid and helps to deepen the socket. The glenoid's a very shallow joint, much like a golf tee with the golf ball sitting on top, which would be the humeral head. And in order to deepen that socket to add some stability is the labrum. So those are the ligaments of the glenohumeral joint. Now there's also ligaments of the AC joint or the acromioclavicular joint, and that's what's depicted here. And these are often what are torn in a shoulder separation or an AC separation. There's also ligaments of the coracoclavicular ligaments connecting the coracoid to the clavicle, and so these are often called the CC ligaments. These can also be torn in a shoulder separation. So a shoulder separation is when a lot of times the shoulder blade or the acromion gets depressed, whether you get hit into the boards or fall directly on it, falling off of a bike, and that shoulder blade gets depressed down and that clavicle pops up, tearing the AC ligaments and then often tearing the CC ligaments. So those are the main ligaments of the shoulder. And then going on to talk about the muscles or the tendons of the shoulder. So remember, a tendon connects muscle to bone. So when we talk about the tendons or the muscles of the shoulder, that's when we're talking about the rotator cuff. So the rotator cuff is made up of 4 muscles that turn into tendons that then attach along the humerus. So we have one in the front, which is the subscapularis. We have one on the top, which is the supraspinatus. And then we have 2 in the back of the shoulder, the infraspinatus and the teres minor. So these all start as muscle bellies attached around the shoulder blade, and they start as muscle belly here, and then as they get closer to the humerus, then they turn into tendons. So here we see the muscle bellies transitioning into tendons here in the animation, with the muscle bellies in the more red color and the tendon as the more white color. And they attach around the whole shoulder here, and they form a cuff of tissue, hence the rotator cuff. And here we can see those rotator cuff tendons, which are in white, surrounding the humerus there. So those muscles also add to the stability of the shoulder. They help suck that humeral head into the glenoid, and then they also help initiate those finer movements of the shoulder. And then over the top of all that is your deltoid, or your shoulder muscle, which attaches to that acromion, that shoulder blade, and then attaches down lower on the humerus. So there you have it, the skeletal anatomy, the ligaments, and then the muscles or tendons of the shoulder. So that makes up the shoulder and the basic anatomy of the shoulder.